I need to share something that has been weighing on me for a very long time, something I've hesitated to say out loud because I know the moment these words leave my mouth, some people in my own profession will be uncomfortable with them, maybe even angry. But after spending more than 2 decades practicing medicine and watching what actually happens to real people when they follow every recommendation without question, I've reached a point where staying quiet feels more harmful than speaking honestly. So here it is. Plainly and without drama, sometimes the worst thing you can do for your health, especially after you reach your 60s or 70s, is to say yes to too many medical tests. And I know that sounds backward because we've all been taught the same mantra for years: get checked early, catch it before it becomes serious, stay ahead of disease, prevention is everything. And that message is everywhere, in commercials, in clinics, in reminders sent to your phone. But what that message almost never includes is what happens after a test finds something, because finding something doesn't exist in isolation. It sets off a chain reaction, and that chain reaction can quietly erode your quality of life in ways nobody warns you about. So today I want to walk you through this reality carefully, not to scare you away from doctors or medicine, but to help you understand what you're agreeing to when you say yes without asking questions. Because there's a concept that completely changed the way I practice medicine, something called the Cascade Effect. And once you understand it, you start seeing it everywhere. The cascade starts when a person who feels fine goes in for a screening test. Maybe out of caution, maybe because they were told they should, the test comes back and shows something slightly off: a spot, a shadow, a number just outside the normal range. Something that might be completely harmless and might have been there for decades without ever causing a problem. But once it's seen, it can't be unseen. And now the doctor feels obligated to act, because what if it's serious and they ignore it? So you're sent to a specialist. The specialist orders another test, usually more detailed. That test still isn't clear. So now a biopsy is suggested, or a procedure, or even surgery, and every step along the way carries real risks: infections, bleeding, side effects, anxiety, time lost. And when you finally reach the end of that road, very often you're told it was nothing. It was never going to hurt you, but you've already paid the price in stress, procedures, and sometimes permanent complications. And you're worse off than when you started, all because of one test you got while feeling perfectly healthy. And this pattern repeats itself over and over again, especially in older adults. So let's talk about the kinds of tests that most often start this cascade, beginning with one that sounds incredibly smart and modern: whole body scans. Full body CT scans, or MRIs, that promise to look at everything at once. You've probably seen the ads: scan from head to toe, catch disease early, take control of your health. And on the surface, it sounds like the ultimate preventive tool. Who wouldn't want a complete picture of what's happening inside their body, especially as they age? But here's what actually happens. A healthy 65-year-old with no symptoms gets scanned, lies in the machine for half an hour, and a few days later reads a report that mentions a tiny lung nodule, a small kidney cyst, a spot on the liver, followed by a recommendation for follow-up imaging in a few months. And in that moment, something changes. You walked in feeling healthy and walked out feeling fragile. Suddenly, every breath makes you think about your lungs. Every ache makes you wonder if something is wrong. And when the follow-up scan shows the same finding or a tiny change that may not mean anything, you're referred to a specialist who, understandably, wants to be thorough. And now a biopsy is on the table, which means needles, anesthesia, real risks. And here's the part that surprises people. When healthy adults over 60 get scanned this way, unusual findings show up in nearly everyone. We're talking about the vast majority of people. These are called incidental findings, things discovered by accident, and most of them will never cause harm. They're simply part of having a body that's been alive for decades, like internal wrinkles. But once found, they demand attention, and that attention leads to more testing, more procedures, more anxiety. And studies have followed people who get these scans and compared them to those who don't, and the results are sobering. The scanned group doesn't live longer, doesn't avoid disease, but they do experience more anxiety, more depression, and more unnecessary interventions. The scans don't make people healthier, they often make them feel sicker. So instead of focusing on images of your insides, the smarter approach is to focus on function. how your body actually performs in daily life. Can you walk upstairs without struggling? Can you rise from a chair without using your hands? How steady is your balance? How well do you sleep? These things tell us far more about your health than any scan ever could. A real health assessment involves sitting down with a doctor who listens, reviews your medications carefully, because many people over 60 are taking at least one drug that's doing more harm than good, and talks with you about movement, nutrition, and social connection. The everyday factors that truly determine how well you age, not chasing shadows on a scan. Another test that frequently causes unnecessary harm is brain imaging for mild memory concerns, and this one is driven by fear. Maybe someone in their 70s occasionally forgets a name or why they walked into a room, which happens to everyone, but family members worry about dementia and push for a brain MRI just to be safe. And that fear is understandable, but getting an MRI for normal age-related forgetfulness often creates more problems than it solves, because the report comes back filled with medical language like age-related atrophy, white matter changes, small vessel disease, terms that sound alarming but are completely normal for an aging brain. They describe what almost every brain looks like at that age, just like wrinkles describe aging skin, but those words can make someone feel like their brain is failing even when their thinking is perfectly intact, and research shows that more than 90% of healthy adults over 75 have so-called abnormal findings on brain scans. Yet most function just fine. The images don't reliably predict memory or cognition. What matters is function, and that's why simple office-based cognitive tests are far more useful. Asking someone to remember words, draw a clock, do basic mental tasks, these tests measure how the brain works, not just how it looks, and when problems show up, many causes are reversible. Medication side effects, vitamin deficiencies, depression, sleep apnea, thyroid issues, addressing those can restore clarity without any imaging at all. Scans should be reserved for situations where symptoms are clearly progressing and affecting daily life, not for normal aging. Another common trigger of the cascade is routine cardiac stress testing based solely on age, especially before surgery. Someone in their 70s who walks regularly without chest pain is put on a treadmill because protocol says so. Even though their daily life already proves their heart can handle exertion, stress tests in older adults have high false positive rates, meaning they often suggest a problem where none exists. And once that happens, invasive procedures like cardiac catheterization follow, procedures that carry real risks and often reveal nothing more than expected age-related changes, yet now the person is labeled as having heart disease, put on new medications, and may become afraid to stay active, losing confidence and quality of life. A far better way to assess future risk without triggering invasive cascades is tools like coronary calcium scoring, which provides useful risk information without automatically leading to procedures. And then there's colonoscopy screening later in life, a valuable test when used at the right time, but one whose risk-benefit balance changes with age. Colonoscopies prevent cancer by removing polyps early, which is why they're strongly recommended in middle age, but after 75, especially for people with prior normal exams and no special risk factors, the benefit shrinks while the risks grow. Dehydration from PrEP, complications from sedation, and the increased risk of perforation, which can be life-altering in older adults. Most guidelines now recommend stopping routine screening somewhere between the mid-70s and mid-80s, shifting instead to symptom-based evaluation and lifestyle-focused prevention, paying attention to warning signs and prioritizing fiber-rich diets that support gut health without risk. And when you step back and look at all of this together, the pattern becomes clear. These tests aren't inherently bad, but when used without context, without asking whether the person will truly benefit, they can start cascades that harm more than help. Health isn't about perfect numbers or flawless images. It's about function, independence, and the ability to enjoy life, whether that means spending time with family, staying active, or simply living without constant fear of what a test might find. And this is a message that channels like Dr. Sara Williams aimed to bring forward honestly because patients deserve transparency. They deserve to understand that sometimes the healthiest choice is not doing more, but doing what makes sense for their body and their stage of life. Being a smart patient means asking questions, understanding risks, and remembering that you are not a checklist or a protocol. You are a person, and medicine should serve your life, not quietly. Take it over one unnecessary test at a time.